In coordination with qualified psychotherapists, music can really be used to kind of provide a safe container for exploring psychological issues. When we think about music that makes you cry, sometimes we can kind of have emotions that are really pent up.
Music therapist Eva, vegan, the compelling health benefits of music therapy, part 1 of 2. Continue watching to find out more.
Animal people eating religious leaders will be punished heavier because you know the right but you do the wrong.
Hello translates as hello in Seychellois Creole. That's how the friendly Seychelles people may greet you if you ever visit one of their numerous islands. Angelic viewers, my name is Angie. The kind Seychellois thank you for being a shining example of generosity and compassion who guides others toward a brighter world. Welcome to our show, Music Therapist Eva, vegan, the compelling health benefits of music therapy, part 1 of 2. Today, we are privileged to invite vegan American music therapist Miss Eva to introduce music therapy. Miss received her Bachelors of Music in Music Therapy from Western Michigan University in the United States and became a certified music therapist after the completion of her internship at a hospice. She previously worked for Journey Care, a provider of palliative, supportive, and end-of-life care for patients of all ages in Illinois. With many years of experience in music-related treatment, Ms. sees great potential in music to enrich people's lives and provide comfort. Currently, she extends her compassion to the people of the animal kingdom by being part of the Animal People Rights Movement as legal coordinator for Direct Action Everywhere, a Shining World Courage Compassion recipient. To many people, music is a way of expressing themselves. It allows us to communicate without any cultural or linguistic barriers. In addition to being an outlet for artistic creation, what music can bring to our lives is much more than we might think.
Music can be used for wellness as well as to treat illnesses and disorders, and music therapists can work on enhancing wellness in addition to treating disorders. There's extensive research in a lot of different fields of music therapy, so the strongest research that I've seen has been in the NICU, the Neonatal Intensive Care Unit. We've seen programs that get babies who are born too early to start feeding when they're having a difficult time absorbing nutrients because they maybe don't have the suckling response really honed yet, or they're having a difficult time reacting to all the stimulation in their new environment after they were born. And we find that babies can go home on average a week earlier with music therapy than without, which saves lives and also saves hospitals really a lot of money. Music therapy's origins happen around the 1940s. We think of volunteers who were singing to war veterans in hospitals for pain reduction. From there, slowly different associations formed, and board certification has been around for several decades the way that it exists now. So now if someone says that they're a music therapist, we know exactly what they mean, that they've been through this board certification process, which includes a 4-year university, a 6-month internship, and a board certification exam. Music therapy is the individualized use of music therapy interventions to achieve therapeutic goals by a credentialed professional. It's kind of a mouthful. In a nutshell, I say that music therapy is a set of ways to use music to achieve non-musical goals. So we think of the kinds of things that a music teacher would work on. They're going to be looking at musical goals, trying to make somebody a better musician. Music therapists look at other types of goals. So those might be physical, emotional, or even spiritual.
During the course of treatment, many practices can be employed to suit the needs of individuals, including listening or dancing to music, singing, playing instruments, or discussing music.
Music therapy in hospice is very, very useful, and it can be useful for all sorts of reasons. It can be useful for improving the quality of life for people with dementia. Often people with dementia don't really know what they're going through, or at least it doesn't seem that way, but music therapy can really improve their quality of life. I think basically anyone can benefit from music therapy or from music wellness programs. It's particularly beneficial to babies and mothers in the NICU, for people in hospice, for kids in special education programs, for people with physical disabilities, for people with brain damage, for people with emotional disabilities or emotional disturbances. I think that music therapy is applied to a very broad range of people, and I would encourage music therapy to be tried in conjunction with other therapies wherever recommended. In coordination with qualified psychotherapists, music can really be used to kind of provide a safe container for exploring psychological issues. When we think about music that makes you cry, sometimes we can kind of have emotions that are really pent up, and having a music experience in a really safe environment, something like songwriting or analyzing the lyrics of a particularly powerful song, we can sort of open up that container and allow us to process some of those harder emotions. And so when there's a professional in the room who's really able to help a client work through some of those really difficult emotional processes, then that's when music therapy can really help with things like trauma or anxiety or some of these really deep-seated emotional problems.
Maybe that's why some people instinctively choose to listen to more calming music when they are in sorrow.
Vegan tested negative for cruelty.
We will pause a moment to enjoy some soothing music, and we'll be right back. Please stay tuned to Supreme Master Television.
My friend, you will not walk alone.
Welcome back to music therapist Eva Heimer, Vegan, the compelling health benefits of music therapy, part 1 of 2 on Supreme Master Television. Let's continue to learn more about other ways that music therapy can help us. Music can act as a means to examine, realize, and dig out deep emotions. Do people get to choose their favorite genre of music during therapy?
Often religious music is used in hospice. Music that's particularly important to a person in their faith can kind of bring up a feeling of sacredness and a safety to be able to really examine some of these things that we need to deal with while we're coming towards the end of our lives. It really depends on the intervention, but when I was working in hospice, I always wanted to know what someone's preferred music was, because preferred music is always going to be better when we're talking about something like lifting moods and things that involve pain management, because whatever makes you feel the best is going to be obviously the best music for you.
When we are absorbed into the melody of music, it seems as if we are enclosed in a sphere where we can temporarily forget all the stress. Sometimes, it even lessens our pain mentally and physically.
We definitely see the release of some of those pleasure hormones. You think of dopamine and serotonin when hearing pleasurable music or music that's preferred. And that can certainly be used in music therapy to improve mood or make certain activities more tolerable if we're thinking of exercise or schoolwork for children. And music, for so many people, is a really important coping mechanism for stress and a really important way to deal with it and to lower stress in their body, even in spite of external stressors in their lives. Lowered stress is related to all sorts of wellness outcomes. So we expect people with lower stress to even live longer, to sleep better, to have lower instances of obesity. Lowered stress and measures of lowered cortisol is related to really unlimited wellness outcomes in the body.
In addition to relieving stress, Music therapy can also help people with chronic obstructive pulmonary disease or COPD, which is chronic inflammation in the lungs that causes air to pass through less smoothly.
We certainly see a lot of people with COPD and other respiratory problems in hospice work. We'll see very shallow breaths from people who are in a lot of pain. What a music therapist will often do in that context is kind of sync up with the rhythm of the breathing. And when the music and the breathing, the biological rhythm are synced up, the music therapist has the ability to actually slow down that music and thus slow down the biological rhythm that we've synced up to and actually make the breathing slower and longer in a way that really relaxes patients and reduces pain and respiratory distress.
Today, we will continue to explore how music therapy can contribute to our wellness and find out how the brain reacts to music. Miss Hamer received her Bachelors of Music in Music Therapy from Western Michigan University in the United States and became a certified music therapist after the completion of her internship at a hospice. She previously worked for Journey Care, a provider of palliative, supportive, and end-of-life care for patients of all ages in Illinois. With many years of experience in music-related treatment, Ms. Hamer sees great potential in music to enrich people's lives and provide comfort. Currently, she extends her compassion to the people of the animal kingdom by being part of the Animal People Rights Movement as legal coordinator for Direct Action Everywhere, a Shining World Courage Compassion recipient.
We know that music really works globally in the brain. A lot of different functions, we can kind of identify a particular area of the brain where they live, which means that if you have a deficiency or an injury in a certain area of the brain, then that can lead to impaired function. So if you have a certain kind of brain injury, you might not be able to speak. But music doesn't really work quite the same way as speech does or as motor activity does. And it can really live globally, we say, meaning in all areas of the brain. And so when somebody has a deficiency or a injury in a particular part of the brain, using music to work on that deficiency can actually reroute some pathways around the part of the brain that's injured to relearn some activities and some skills that have been lost. When people have a degenerative disease such as dementia, they can really lose a lot of that ability to learn and grow. There's no cure for Alzheimer's yet, and I really hope that we see a cure in our lifetime. But what we know, music therapy can really help the quality of life of people with dementia and neurodegenerative diseases by stimulating some of the skills that are still there. We talk about music kind of existing globally in the brain. Whatever is still functioning in someone with dementia can often be stimulated by music. So I worked with a lot of patients who weren't able to speak anymore, weren't able to walk, weren't able to do really much of anything, but often those same people were still able to sing with me and able to kind of come out of their shells and interact through music.
The brain's ability to change and move a function from a damaged area to an unaffected area to adapt is called neuroplasticity. Through activating this process, patients can gradually find their connection to the world again.
People with speech impairments are helped immensely by music therapy. There's an intervention called melodic intonation therapy, and it's done by both music therapists and speech therapists. And it's this very regimented way to teach people to speak again when they've lost the ability to speak through something like brain damage. And it's a very interesting process to watch. It's something where you'll start with some sort of phrase that we want to hear from the patient put into song. So the therapist will take some kind of thing that the person really wants to be able to say. You know, maybe it's really important that the patient is able to ask for coffee in the morning. And so they say, I'd like coffee with 2 sugars. that kind of phrase, let's say. And the therapist will listen to that phrase and how it's kind of naturally said. I'd like coffee with 2 sugars. And they'd listen really hard for the melody that's already present in that phrase. And they would present this very, very melodic version of that phrase to the patient and teach them to sing it. Because we know that even if the speech center of the brain is damaged and someone isn't able to speak anymore, they can still learn to sing. And so through learning to sing, they'll very slowly phase out the music from what the patient can already do. They can already sing the phrase, I'd like coffee with 2 sugars. And very slowly, by taking out the music, the patient ends up being able to speak the phrase that they want to say.
Be vegan, not only you will go to paradise after this life, this world will also become a paradise because of your benevolence.
We will pause a moment for a constructive message and be right back. Please stay tuned to Supremaster Television. Welcome back to music therapist Eva Heimer, vegan. The compelling health benefits of music therapy, part 2 of 2 on Supremaster Television. As we heard previously, it's amazing how those with brain damage can learn to communicate through singing instead of using the normal neural pathways to speak. In general, is music therapy less effective if someone does not have any musical background?
Anyone can definitely benefit from music therapy with or without musical skills. And sometimes musical skills could even be a detriment. Sometimes people who are trained musicians are so used to being skilled that maybe if they've lost some of their skills, that can be really emotionally difficult for them to interact with music. And that's definitely something I've seen in hospice quite a bit. But yeah, music therapy is very useful to anybody with or without musical skills.
A drum circle involves a group of people playing drums in a circle or semicircle, with the participants expressing themselves by drumming a rhythm. It can serve as one form of music therapy.
So often in music therapy, we really want it to be interactive, just like a drum circle. Like we really want to get people involved because it's through doing that we can really solidify a lot of these processes. And so just like in a drum circle, how kind of any non-musician can join in, a music therapy session should really be accessible to the individual and really personalized to their ability level. I think the really cool thing about drum circles is that participants and audience are often the same. People who participate are the people who are playing music, and people who are playing are the ones that the benefit is for often. And I think that it can be a huge mood booster. It can be a way to interact with others. It can be a way to fight social isolation and to improve group cohesion of the group that's participating in the drum circle.
We ended our interview by asking Ms. Heimer about how her experiences as a music therapist have helped in her current career as an animal people rights activist.
Walk with you and sing your spirit home.
Rita, one more time. And so when I got involved in activism, I was already a music therapist, and so it was a very natural thing to do to try to offer that to the movement. I really like to apply the principles of music therapy to my activism, to think about animal rights activists who are experiencing some really difficult things and are experiencing quite a bit of emotional trauma when we think about animals dying every day. And so I love to use music with activists to help their emotional resilience and their group cohesion and their feelings of empowerment and closeness to each other. And so I often lead songs in protests, and I write animal rights songs and try and get as many people involved in music so that they can really feel like part of a group, which was such a powerful experience that I had when I first got involved in activism, was to know that, you know, you are not alone, that there are other people who really care about this just like you do.
We really appreciate Ms. Eva Heimer for taking the time to introduce the valuable role music therapy can play in our lives and sharing how she is now helping the people from the animal kingdom through music. For more information about Eva Heimer, please visit facebook.com/Eva eva.c.hamer, twitter.com/evahamer.
I had quite a few symptoms, but since I went fully vegan, I don't feel it at all anymore. Chris Smalling, vegan.
Vibrant viewers, we are honored to have you with us today for the concluding program of our two-part series. Up next is Catholic Priests Should Preach the True Gospel of Lord Jesus, Part 6 of 8, on Between Master and Disciples. May your days be filled with serenity and contentment always.
Our programs offer many languages. Please visit suprememastertv.com/schedule and suprememastertv.com/HL.